Well, I am glad to see I'm not the only person who brought notes scribbled on a little piece of wrinkled paper. So I'm going to try to be sure that I can see everything I was supposed to say to you tonight. Anyway, just by way of a little personal background, today is sort of an anniversary for me, because it was 11 years ago today that my husband and I took our 15-year-old son to the hospital for an operation that he would not survive. 11 years ago today, we were having a different kind of dinner. It was not something we knew would be the last supper. It was my son's first glass of wine, the first that we knew about, in a restaurant in Charleston, South Carolina. But for us, that event was the beginning of a personal odyssey into a field for which we hadn't previously even known there was a need: patient safety. We couldn't know that Linda Kinney had suffered her devastating medical experience almost exactly a year earlier. Within 2 years, we had both started organizations directed at the problem of medical error. And we were among a number of people who got started around that time, who are still going. And we joined Eileen Karina, who was one of the pioneers, who is here tonight, and who was an inspiration to me, and I'm sure also to Linda. But the impetus really began, I think, with the IOM report in 1999, almost exactly the same time as Linda's error. And what we were doing began to stick. We started to get some traction. So now, it's 10 years later, and here we all are. All of our patient organizations have niches, but MITSS has a special niche, because MITSS deals with the problem that is really the most important to patients, and that is the problem of abandonment and failure to communicate after medical harm. This is crucial to patients because they view it as the ultimate betrayal. And MITSS has tackled this head-on, not just with their services to patients, but with their services to providers, which makes the system responsive and in turn provides a service to patients. People sometimes forget that we're all in this together. If we can ease the fears and traumatization on one side, then we can ease it on the other. MITSS has been dedicated to reaching across that chasm. We would all do well to take their tools and their lessons and apply them to everything we do every day. We need to learn to talk to each other, to console each other, and to work together to learn from these events. This is not just about providers. It's not just about patients. It's about what we can do together, because learning and improvement is the only good that can come from any of this. So, as time has gone on, the patient safety movement, and I view it from a very different prism from most of you, because we view it from the prism of the patient organizations, of which there are a number. And we have watched it grow together and grow toward the providers, get a lot more cooperation, a lot more closeness with the providers. I've really been pleased to be part of that, and I'm really proud to see this crowd tonight and to have been part of this. And I want to thank Linda and MITSS and all of you for all that you've done to advance this cause. Thank you.